public hospitals are now operating with a shortage of over 10,000 nursing staff and a shortage of over 1,300 doctors. Well, considering the pressure on public health care, these positions remain unfilled. The Health Minister, Dr. Joe Parker, blaming budget cuts for the delay in recruitment. While all of this is happening, many qualified nursing staff are going to other countries. Well, to talk more about the country's healthcare sector, we're joined by the General Secretary of the Treatment Action Campaign in Nelson Mandela Bay, Anele Yawa. Anele, good evening to you, and thank you very much indeed for your time. The Minister himself saying that there are these big shortages of nurses and doctors. These posts were created at one point. Why do we have such a shortage in our public healthcare system?
Greetings to you, Stephen, and the viewers at home. Unfortunately, Stephen, I'm currently at Limpopo. So, Stephen, to be honest, as the country, we need to apportion the blame on medical negligence and the money our Department of Health is paying for these medical legal claims. I will give you a typical example, Stephen. The Auditor General between 2018 and 2019 said in all provinces across South Africa, the money which the Department of Health paid out for medical legal claims was about 2 billion. In 2020-2021, the Auditor General is saying about 1.5 billion rands has been paid by the Department of Health nationally, including all provinces, on medical legal claims against a budget of 222 billion. So you need to ask yourself, if you are paying about 1.5 billion against the budget of 220 billion for provision of healthcare services, what does that mean? It means half of the money which is budgeted for improving the quality of healthcare services does not go there. It goes to medical legal claims. What causes these medical legal claims? These medical legal claims are caused by the shortage of human resources within our healthcare facilities. But also coming to the issue of the shortage of doctors and nurses. The minister here is only talking about the hospitals, but we must ask ourselves what it will mean if the minister can include our clinics. If you were to go to our clinics, as I'm talking to you, majority of our clinics have a shortage of human resource. If you were to go to our clinics, as I'm talking to you, majority of them do not have permanent operation managers. They are on acting basis, rotational. What does that mean? Also, we need to understand, Stephen, that COVID-19 came with disruptions, and as the result of that, there are many healthcare workers who have succumbed to COVID-19. So if now the Minister of Health is saying within the hospitals that there's a shortage of 10,000 nurses and about 1,300 doctors, we must ask ourselves, if we are to include the more than 3,000 clinics that we have in our country, how the number is going to look like. Also, Stephen, we need to understand that in South Africa, out of the total population of South Africa, about 42 million of them are public health care users. Then let's look now the population or the number of people who are public health care users within our population vis-a-vis the healthcare workforce. Our healthcare workforce in South Africa, both in private and public, is not more than 400,000. What does that mean? It means, therefore, if we have a lesser healthcare workforce, they will be overworked and their working conditions are unbearable, they will be frustrated, and they won't be able to deliver the quality of healthcare service. It is against that reason, as TAC and other progressive forces, we are saying to the Treasury and to our government, if our government is able to bail out SOEs like your SAA, your ESCOM, and you name them, let our government bail out our public healthcare system. Because here we are not talking only about business interests, but we are talking about the lives of more than 42 million people. Therefore, it means if our government recognizes that health is a fundamental human right, it therefore means that we need to protect this right. And the only way to protect this right is to ensure that we've got enough healthcare workers who are working in better conditions in order for them to be able to provide quality healthcare services to the people of South Africa.
Would more money fix the problem? Is it just money? I mean, money will fix many problems. But is there also an issue with management? I mean, we do spend quite a large amount of money, quite a big proportion of our budget, on healthcare, on the public healthcare system. I suppose the question I'm really asking for is, despite the high patient load, are we getting value for the money that we spend?
We are not, Stephen, because the first question, the question you are asking is the right question, but you are asking it from a wrong person. You must understand here, I am not a decision maker. I don't ensure that government programs are implemented. But what we have seen, let's take a typical example on the issue of Brian Songwa, the former MEC of Health in Gauteng. A lot of money was looted by Brian Songwa and these small companies that were also giving kickbacks to him and the government. But let's look at the digital vibes. How much was spent? So if our government was able to recoup all these monies that were stolen by politicians, including also coming up with a turnaround plan as to say, how do we ensure that we minimize these medical negligence cases? It therefore means we will have enough money, but also if there is no political will and a political commitment from those who take decisions to ensure that decisions that are taken are implemented, and also make sure that when we implement these decisions, we are non-partisan. One of the problems we have, Stephen, if you were to look in all the government, in all the 10 Department of Health in South Africa, that is 9 provinces and national, we have a lot of administrators. And most of those administrators were never appointed in those positions based on their credentials and qualifications. Some of them are political deployees. Do we need administrators in this situation? No. We need frontline healthcare workers. So when we talk about human resources for health, we need to understand here that we're not merely talking about administrators. We're talking about foot soldiers, people who are going to ensure that they are on the ground, they are within our facilities, providing quality services to our people. But the problem that we have is corruption and the looting of state resources, which continues to steal from the poor. So if our government and our National Department of Health, as we said in our submission during the NHI oral submissions as well as written submissions, the Department of Health needs to work with SIU and establish an anti-corruption unit within that department to ensure that each and every cent that is budgeted for provision of services goes directly to provision of services, but not into the pockets of the politicians as well as some of the public servants. So what kills our healthcare system is a lack of political will and corruption. If we can keep that, we are 100% sure that we can be 2 or few steps towards what we want to achieve in terms of universal health coverage.
Anele Yawa, thank you, General Secretary of the Treatment Action Campaign. Do appreciate the time on the pulse tonight.